So this peritoneum is name is tunica vaginalis. Now it is the same peritoneal layer that is inside the abdominal cavity. So then what is my interest? Why do I need to know this? Because this tunica vaginalis is nothing but it is a continuation of the peritoneum. That's why if somebody gets trauma to the testicles, trauma to the scrotum, why they get referred pain in the abdomen? Because the peritoneum gets irritation and it has the same nerve root supply. That's why if somebody get the trauma to the testicles, the pain comes this area and patient feels nausea, vomiting. Always keep that in mind. Irritation to the peritoneum, it gives the feeling of nausea and vomiting. Okay. So now, physiology of the male reproductive organs. Okay, before physiology, I just want to add little. You know that the fertilization when took place between the sperm and the ovum, right? Mm-hmm. So sperm could be X, could be Y. But the ovum always X. Okay? So now if this X combined with this X, 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 this is a girl. And if this sperm is Y, this Y and this X will combine. So X, Y, this is a boy. This is a boy, right? So now why it is boy? Because of this. Why? Because this Y chromosome has sex determining factor on it, and it is expressed around 7 weeks in the embryo. 7 weeks, at the age of 7 weeks, that X expressed the sex determining and gender determining factor. Then they will say, oh, this embryo will turn into a boy. If that sex determining factor is not expressed, it will be girl. Okay? That's why they said this is responsible for determining the gender, the Y. Okay? And okay, physiology. Physiology means function. Physiology is the function. We need to learn the physiology of the couple of male reproductive organs. Physiology, we're going to learn the physiology of the testis, physiology of the seminal vesicle, seminal fluid, physiology of the prostatic fluid. Okay, we need to know that. Testis. Testis is a gonad, right? We call it male gonad. This male gonad testis has exocrine function and has endocrine function. Exocrine means what? Exocrine means this functional part must have a duct through which the secretion will discharge or come out. But endocrine is a ductless part. So hormones will go directly into the blood by diffusion. So now exocrine part is spermatogenesis, because this spermatogenesis needs a seminiferous tubules. Seminiferous tubules, then seminiferous tubules to the vas deferens, then vas deferens, and through the vas deferens the sperm expelled out, right? So this part is exocrine. And endocrine part is production of the testosterone. Production of the testosterone. Testosterone is a hormone. And spermatogenesis and production of testosterone are very much dependent. Testosterone is needed for the spermatogenesis, and this testosterone is produced by interstitial cells of Leydig. Okay, or Leydig cells. Okay, so this is the functions of the testis. And we need to know a little histology about the testis, that what are the different types of cells inside the testicles.
You could do it.
So this is testis, this is epididymis, and this is testis. So now the testis is covered by a whitish covering known as tunica albuginea. Alb means whitish. So this is tunica albuginea. This tunica albuginea on its posterior part here, it goes inside and it divides the testis into multiple compartments. Okay, so now in this way there are 250 to 400 compartments are there, and this compartment is created by the tunica albuginea. Tunica albuginea. It goes inside from the posterior part and then it makes the compartment. Just like a five-star hotel. You see the compartment means the room side by side, multiple rooms. Yes. And each compartment has 1 to 4 seminiferous tubules. Okay, so this is seminiferous tubule. So each compartment has 1 to 4 seminiferous tubules. So there will be seminiferous tubules, okay, you got the idea, right? So this is seminiferous tubules. So now if this is the seminiferous tubules, if you cut the testis, then you will see seminiferous tubule cross section. Then in between or among the or outside the seminiferous tubules there are a group of cells. These cells are Leydig cells. So these are Leydig cells. That produce testosterone. And inside the seminiferous tubules there is spermatoproduction cells called spermatogonia. Okay, so these are the spermatogonia. Spermatogonia that forms, they produce the spermatozoa. So when the spermatozoa is produced, it has a tail. And this is immature sperm. And these are the Sertoli cell. These Sertoli cells will feed the baby sperm. That's why you will see initially the sperms are attached with the Sertoli cells. When you see the sperm is attached with the Sertoli cells, they are still in the process of growing maturity. So this is immature sperm. If you see the sperm is in the center of the seminiferous tubules, so these are relatively matured. Okay, so now what are the three different types of cells inside the testicles or inside the testicles? Three different types of cell. Number one is spermatogonia. Number two, Leydig cells. And number three, Sertoli cells. These are the three different types of cells. Question: why do I need to know this? Because the seminoma, the malignant tumor, comes from the spermatogonia, which is more common. Seminoma, malignant tumor, intratesticular malignant tumor. That seminoma forms from the spermatogonia cells. There would be cancer tumor from the Leydig cells. There could be cancer from the Sertoli cells. So now we know the histology. So now we can say that there is a probability of arising some bad pathology. Then who are the sources? Different types of cells. So now you probably noticed that at the posterior part of the testicles here, there is a dilated tubes with a network like this. That is called Rete. Rete means net. Because of the thing that 200 to 400 250 to 400 compartments, and each compartment has 1 to 4 tubules, and finally one tube forms. That means how they will be joining each other, just like a branch of a tree. If you consider the thousands branches of the tree coming down to make one stem, how they united each other, how they joined each other, right? That's the way they will join each other, and they will form a network at this posterior part known as Rete testis. So this part is Rete testis. Okay, so this is Rete testis, and there will be what is called that connective tissue framework. This is hyperechoic line from one end to other end. This is the connective tissue framework that is hyperechoic, known as mediastinum testis. Don't get mixed up Rete testis and mediastinum testis. Rete testis is a dilated or convoluted seminiferous tubules at the posterior part. Looks like a net. And that is Rete testis. And mediastinum testis, if this is the testis, you will see hyperechoic line. This is called mediastinum testis. We can see this. This is mediastinum testis. Actually, this is the framework of supporting the seminiferal tubules. Or you can say other way, it is the framework that supports the Rete testis, and that is hyperechoic. Okay, so this is in short the little histology. So now I will go to the physiology. First, testis I'm done. So now seminiferous fluid, seminal vesicles or seminal fluid.